This video aims to provide a learning overview for the local SAR, Adult L. Full reports, extended learning briefs, and other associated learning are available at www.rochdalesafeguarding.com. Adult L came to the United Kingdom with her mother and siblings from Nigeria to seek asylum when she was around 12 years old. When Adult L was a teenager, she had a period of child-in-need support, which culminated in being accommodated into local authority care. After a number of placement changes, Adult L settled with a foster carer and then went on to supported living accommodation when she turned 18. As she got older, Adult L lived with long-standing issues with weight management. Upon admission to hospital for sepsis, she was a bariatric patient. During this time period, Adult L's home property had been noted to be unkempt and had an unpleasant odor. Adult L agreed to a deep clean of her home, and a Care Act assessment was carried out by Adult Social Care. However, Adult L declined further support and was deemed to have capacity to make this decision. Rochdale Borough-wide housing subsequently submitted a safeguarding referral. A social worker contacted Adult L. She agreed to allow nurses into her home, as well as considering mental health support being delivered by telephone. Unfortunately, nurses were unable to gain access to the property. Adult L was found deceased in her bed 2 months after the initial social worker conversation. A safeguarding review referral was made, and the RBSAB commissioned an independent review. The following video sections consider safeguarding learning and what needs to happen to prevent similar cases happening again. Full details of these learning points are available on the RBSAB website. Professionals often struggle to engage with Adult L, but this was not shared effectively across agencies. Agencies should be assured that the workforce has professional curiosity capabilities, and multi-agency information sharing processes are well known and shared widely. These processes may include the MDT or MRM protocols, both of which are available on the RBSAB website. Adult L faced 2 barriers when engaging with services: a high body mass index, which resulted in problematic mobility, and low mood, which resulted in a lack of motivation. Both barriers directly impacted the agency's ability to engage with Adult L. The lived experience of Adult L were not explored by agencies. This indicated a lack of knowledge of how to open a dialogue about weight management when supporting people experiencing obesity, mental health, and who are at risk of harm. Agencies should consider how they can support the workforce to reflect how obesity impacts assessment and planning. Also, how physical or mental health factors for care needs may differ in different adults. It is important to listen to, educate, and possibly challenge patients with extreme obesity who decline services. It is also important to advise on the importance of weight intervention whilst simultaneously respecting their autonomy. It is a RBSAB requirement that learning from SARS is embedded into practice. Agencies should encourage the attendance of frontline, decision-making professionals to safeguarding adult review learning events. Agencies should also consider how they use single-agency business processes to inform their workforce about safeguarding learning. Then, how can they assure the RBSAB that embedding of learning has been effective? The RBSAB website contains information which relates to this Adult L learning overview. This includes multi-agency training for professional curiosity, documents regarding multi-agency information sharing, and detailed information regarding the Adult L safeguarding review. We hope this learning overview has been informative.